Thank you, Sue. Good morning, colleagues. It's delightful to be here to talk to you all, to everybody in the room and also online. Thank you very much for the invitation. Do you know, it's 40 years this year since I qualified as a midwife. And I guess the most important thing I've learned over that time, which has been a rich and really important time for me of learning, is that what matters most is what's coming next. And I'm so pleased there are so many students in the room. And I will hope to talk, in fact, to you most of this talk, because you are the future, and it's the future of midwifery and how we deal with the mothers, the babies, the families who are still coming into our hands over time. That matters most. It's how we move forward from where we are. So my topic today is the future midwife, looking to 2030 and beyond. And I'm having the privilege at the moment of looking at this in two different arenas. One is globally, where I'm doing work with the World Health Organization to look at midwifery education internationally. And I'm going to be talking about that. So for the first half of my presentation, I'll have that hat on. I will be talking about international perspectives, a quick recap on the Lancet series, and then what's happening globally in terms of midwifery education. And for the second half of my talk, I'll have a different hat on, and I'll be talking about the work that I'm doing with the NIMC. So hopefully move seamlessly from one to the other. So briefly, Sue mentioned the Lancet series on midwifery. It was an astonishing privilege to work starting in 2011 and moving through 4 papers published in 2014 and another one in 2016 with a group of 50 authors globally from umpteen different countries and 5 different continents and lots of different disciplines to put together a new look at the evidence around the impact of midwifery, why it matters, and indeed what it is, because people kept saying to us, but what is midwifery? And you would think that's self-evident, but actually, when you look internationally, it's so variable across so many different countries that it's an important question. So we had to grapple with that one as well. These are the reasons why the series was important. Totally unacceptable levels of mortality, low quality care, and escalating interventions globally. People kept saying midwifery is important, but they didn't know how to spread it, to implement it, or indeed to really pin down what it is and what it does. Very inconsistently understood and implemented, often invisible. And even in countries where midwifery is strong, often it's limited, its scope of practice is limited. So finding a way in which full scope midwifery can truly be implemented was one of our goals. Professional midwives face strong barriers, focus often on essential and emergency skills and on birth rather than the whole continuum in the woman's journey. Yet prevention and support, you know this, and longer term care and longer term outcomes are incredibly important for the vast majority of women and babies who do survive. And so we needed a re-examination of the evidence, and that was what we did. This is the front cover of the series that we were all immensely proud of when it finally saw the light of day. Midwifery is a vital solution to the challenges of providing high-quality maternal and newborn care for all women, all infants in all countries. Very much a human rights-based lens on midwifery as the core, essential first service that everybody needs on their entry into the world, and that all women need going through that life-changing experience. So we defined what we're now calling full scope midwifery, because there's a lot of limited scope midwifery around in the world, and we thought this is the definition, and it's the definition from the perspective of women, babies and families, not from the perspective of the system. And it's what all women and all babies need. It's skilled, knowledgeable and compassionate care for childbearing women, newborn infants and families across the continuum from pre-pregnancy, pregnancy, birth, postpartum in the early weeks of life. Core characteristics include optimising normal biological, psychological, social and cultural processes of reproduction and early life, timely prevention and management of complications, consultation with and referral to other services, respecting women's individual circumstances and views, and working in partnership with women to strengthen women's own capabilities to care for themselves and their families. And so that was worked through with a whole lot of consensus, but drew directly from the evidence around what women and babies and families need and want. We then went on and said, okay, so how do we build that into a set of, if you like, building blocks for quality care? How do we take that? How do we then build on all the evidence around what women need and build that on quality care? So I don't know how many of you have seen, before Tracy showed it to you briefly this morning, the framework that comes from this series for quality maternal and newborn care. If you have seen it, you're going to get a quick refresher. If you haven't, you're going to get a quick introduction. I should say all the papers are downloadable free off the Lancet website. You don't have to pay for them. You do have to register. You don't have to pay. So I'm going to unpick this. I'm sure you can't see this at the back of the hall because the slides are small, but I'm going to unpick it and show you each component very briefly. We will whiz through it. Now, why am I talking about this? I'm talking about this because it's becoming the building blocks for a lot of people globally as they design midwifery education, and we're certainly using it in the NIMC work that I'm going to talk about next. So we interrogated all the evidence. Over 600 different pieces of evidence went into building this. And we built it, so I'm going to talk about it from the top down. We said that quality care is needed for all childbearing women and infants, and then you need additional care for women and infants with complications. It's not a low-risk, high-risk split, it's an all women and then a plus component as well. What do women need? They need practices, interventions, they need these things. So all women need education, information and health promotion. All of them need assessment, screening and care planning. All of them need promotion of normal processes and prevention of complications. Added into that, some women need first-line management of complications, and some women and babies, of course, will need additional medical, obstetric and neonatal services. But it's not just what people need, it's how you provide it. So there's the organisation of care. That involves care that's accessible and acceptable for everyone, with continuity and integrated across community and facilities. It's how you do it with values of respect, of communication, of community knowledge, of tailoring care. It's how you do it with optimising normal processes, and it's who provides it, and that's practitioners with the right skills, the cultural sensitivity, and working together seamlessly to organise that care. Then you put the scope of midwifery around that quality care, and the blue line there shows you that it's encompassing the great majority of what women, babies and families need. So that we're proposing is what they need. That we're proposing is the basis not only of service planning, but of education. And so students everywhere, midwives everywhere, need to know how to provide that. It's not just what we do, it's how we do it. And I think every session this morning has had that message at its heart. So getting the services right, what we do is right, but it's also how we do it. Thinking globally for a minute about perspectives on midwifery education, there are huge challenges globally. There are barriers to midwifery written in this World Health Organization report, free to download off the WHO website, Midwives' Voices, Midwives' Realities, the biggest survey of midwives' views that's been conducted by the World Health Organization, found huge barriers to the quality implementation of midwifery, partly the inconsistent understanding, partly the whole picture is shot through with gender inequality and disempowerment, socioeconomic challenges, professional challenges, barriers in every country that the WHO talked to. So it's challenging to get midwifery education right. Now, for some reason, this isn't moving forward. Can you help me, please? I don't know what I'm doing. Oops, lost. Okay, I'll keep talking while The slides, I hope, come back. What the World Health Organization has done in response to finding the problems and realizing that midwifery education is so important is there now a global alliance of organizations, WHO working with the International Confederation of Midwives, working with UNFPA and working with agencies like the Department for International Development, so funders as well as other agencies, and the White Ribbon Alliance bringing the voices of women into this. So a multi-agency international working to strengthen midwifery education in every country in the world. That's the small challenge that this group has. And there's a series of meetings now running to develop collaboration and action and funding for midwifery education. It has been dramatically underfunded and dramatically under-researched globally. We have recently, my colleagues in Dundee, put together a review of research into education globally and found a very small number of studies doing very focused and very limited work on midwifery education. So there's a huge need to really pull money into this from big funders like DFID and USAID, both of whom are involved in this, but also to work collaboratively so we're all aiming for the same goals. That report that's also on there on strengthening quality midwifery education, again, it's free to download off the WHO website, and it's put forward 5 key recommendations to strengthen it globally. And about 3 weeks ago, I spent a week in Geneva working with about 70 other people on a meeting from different countries, different organisations, really putting together an action plan for midwifery education globally. So the message is being heard. There's a huge amount of work going on. It will be 20 years labour of love, I think, to really get this strengthened and to build it up for women and babies internationally. But it is coming, and for those of you who are interested, you'll really find the information there. So that's the end of part 1 of my talk. I know you're going to want your coffee, but there is part 2, and I'll try and do it briefly, but it's really important because I'm going to pull the lens now back from the international work and think about the UK. So let's think about what we need for the future midwife in the UK through to 2030 and beyond. And in a sense, I have a new hat on at this point. The new hat is that I'm now working with the Nursing and Midwifery Council, as you know, the regulator that regulates standards for education, among other things. And I'm working as the lead advisor to the review of midwifery education standards. So that's a fantastic privileged position to be in. For the Twitterers among you, please do tweet #Future Midwife at NMC News. You might want to copy in. I don't have to tell anyone in this room what the NMC role is. The key issue for the regulator is to protect the public. That's what it's there for. And regulates nurses and midwives in the 4 countries. And it sets standards of education, training, conduct, and performance, making sure that nurses and midwives provide quality health care throughout their careers. Now, there's a stand here. There's some colleagues from the NMC in the room today, and they'll be here at the stand all day. If you want to go and talk to them, please do. And I'm going to tell you in a minute what I'd like you to go and specifically talk to them about that they would like to hear from you. The NMC at the moment is going through a whole review of all of its education programme. There is a lot of work going on. I'm not going to talk about it in detail because I don't have time. But for example, there's new nursing standards. This work on reviewing education standards for nurses has just all happened. There's new papers just been passed a couple of weeks ago, new standards, for example, on prescribing. That is standards both for nursing and midwifery. Again, talk to colleagues on the stand for details of those. But what I'm talking about today specifically is the standards for education for midwives. Why do we need new standards? You know this as well as better than I do. Lots of things are changing that are affecting the lives of women, that are affecting babies, that are affecting midwives, that are affecting the way in which care and services are given. Whether those are background population issues, health profiles are changing. We have different disease profiles, different age profiles, for example. We have a number of investigations into problems, Morecambe Bay, the Kirkup report. There are key messages there for all of us to hear, for example. There are real positive developments. The 4 countries of the UK have done new strategies for maternity and newborn care. In England, you've got better births. In Scotland, we've got the best start, and so on. So we're seeing new policy, new challenges. We're also seeing new evidence, and we want to draw on that new evidence to build the best standards we can for education into the future. So our challenge, the challenge we are being faced with in what we call the Future Midwife project here, is what standards of proficiency should the regulators set to make sure newly qualified midwives at the point of registration are able to meet the needs and wishes of women, babies and families. That's all women, all babies and all families, regardless of their circumstances. That they're safe, that they're effective, and they're compassionate. So how do we set standards that then the universities, if you like, will implement through their education programs so that the future midwife can do those things? That's what we're really focusing on. The timeline, this work started in earnest in April last year. We have all sorts of ways of engaging with people, and I'm going to tell you about those in a minute because it's really important who we're hearing from and how we're doing that. We have a thought leadership group. Tracy sits on that. I think there's probably other people in the room who sit on that thought leadership group as well. We're doing evidence reviews and lots of engagement with all of those people, and as I say, I'm coming back to tell you more about that. There will be a big public consultation next February for several months where everybody, all of you, can engage with what you think about our draft standards, and they'll be published in 2020. So the outline proficiencies have been developed in these ways, and we're at a very early draft at the moment that's going through, as you imagine, quite a lot of formal processes. It's been developed through reviews of current best evidence, key reviews and reports, so lots of updating on the evidence. Very widespread engagement with all the relevant constituencies and a systematic analysis of the findings of that, and I'm going to tell you who that is in a minute. We've got core design principles which just are pretty simple, and you'd recognise they're about being evidence-informed and so on, human rights lens. And thinking about the Lancet quality framework that I've just told you about in part 1, and using that as a structure from which to, if you like, evolve and design the new standards. This is some of the evidence that we've reviewed. We're looking at the 4 country maternity reviews, key maternity inquiries and reports, literature reviews looking at those key topics, a thematic analysis of, so far we've done 5 big engagement workshops, and then other sources of information. The engagement was what I wanted to talk to you most about. Our overarching aim is we want to hear from everyone involved in the whole process about what matters and what midwives should best be able to do at the point of registration. And so those voices we want to hear are the voices of women, the voices of families, the voices of students, newly qualified midwives, interdisciplinary colleagues, policymakers, educators, you name it, we want to hear them. So far, we've been all over the country, talking with people in lots of different ways. We've held 5 what I call cross-sectoral workshops, where we've had all sorts of different kinds of people in the room at the same time talking with each other. We've held 5 of those big workshops in those key cities across the country. We've run 9 focus groups, very really focusing on the constituents we want to hear from most, so students, newly qualified midwives, women themselves, teenage pregnancy and so on. So focusing down on core conversations. Lots of conversations with lots of specific advocacy groups, over 20 advocacy groups so far, and we're continuing on with that, and hearing the details of specific perspectives, because there's lots of different perspectives on groups that represent different kinds of problems, different kinds of families. Meetings with lots of professional organisations, all the Royal Colleges and professional associations you might want us to talk to. Our thought leadership group has met 8 times now. They meet once a month. They are absolutely fabulous. They turn up, they engage, they discuss for 4 hours at a time. And 5 virtual thought leadership group webinars, and those are open and anyone can join them. So I'll give you the details in a moment for how you find that. So if you want to join our webinars, then you can. And you'll get the details at the stand. What are those conversations and what is that evidence telling us? So this is a very brief look at a lot of information that we're currently working through. But the emerging themes from that, are top line important to people, are obviously care that focuses on women and babies and families as its priority, as the most important thing that it does. That it's informed by current best evidence, and that means it changes over time. It can't stop. It's not frozen in time. It has to keep updating. Communication, I think, probably comes out of every conversation as a top line, and it certainly came out in this morning's presentations, Helen's particularly, around communication that doesn't cost anything. You say it one way and it's helpful and healing. You say it another way and it's harmful and damaging. That's not cost, it's not time, that's getting it right. What we're calling the normality complexity spectrum, because you know that women don't divide into nice normal categories and complex categories. Sometimes they've got a complication, but other things are going right. And I think Pete's presentation about women with cancer was spot on. Lots of things are going right in that picture, as well as some of the things that are going wrong. And it's our job as midwives to support what's going right, as well as deal with what's going wrong. Interdisciplinary working, absolutely key. It has to be seamless. Women need lots of different caregivers, but with the midwife in at the heart of that. Continuity of carer, it is coming. I know about changing childbirth from 1993, and before that even, we were all talking about the evidence around continuity being so important. It's coming. It is coming, I promise you. All of the changes that are going through the Maternity Transformation Board in England, through the follow-through to the Best Start in Scotland, it has to come. We know it has to come. Postnatal care and breastfeeding, hugely important as essential skills, basic skills. Mental health built into the whole process, not separated out. Understanding social circumstances, including poverty, inequalities and the related human rights issues. We don't just care for the women who turn up and come to the clinics when or we go and whatever. We have to go looking for the women that we don't normally reach as well. Whether those are women in prison, whether those are women living in poverty and different deprivation, whether those are women experiencing different aspects of inequality. We have to be there for everyone without fail. What happens next? So in the Future Midwife project, these are our plans. From now, we're working on developing the actual draft standards that will go through to NIMC Council in November. Hopefully they will like them and sign them off. At that point, we do a bit of work around the legal and governance issues, and that then in February they come out, as I said, for public consultation. Please do engage with that, because these standards will only be right if people work with us and help us get them right. So formal public consultation with them published in 2020 for the universities to implement. So please do get involved in the discussion, whether that's on social media, whether that's emailing us and getting registered or for information, or joining in the webinars. Please go and talk to the stand today. I know my colleagues here from the NMC would love to hear your views and find out how to get engaged. So thank you very much for listening. I just want to reiterate the fact that education going forward is absolutely the most important thing for midwifery and for women and babies in the country. And now you can go and have your coffee. Thank you.